You have a forward head posture like this, you're working at the computer all day. Well, I'm going to show you guys a simple exercise you can use to strengthen your neck muscles and keep your posture great. So go ahead and push out into my hands. Good. Strengthening those muscles around the neck and those postural muscles. Hey guys, Dr. Will here from Miami Spine and Performance in Hollywood, Florida. We're back here with Annie. We just did some ART and adjusting. She's feeling a lot better, but now we're going to go ahead and hit that download button on her neck pain, and we're going to do an exercise. So I'm going to have you lie face down, please, for me. So at my office, I like to use a system called DNS, Dynamic Neuromuscular Stabilization. So these are developmental exercises that we used actually as babies to learn how to strengthen the muscles in our neck and our shoulder blades. So, as we go through life, poor posture, working at computers, sitting and things like that, we lose some of these fundamental patterns, okay? So what I'm going to have you do, Annie, is you're going to bring your arms forwards for me, just like so, okay? And for those of you that have children, you might have seen your child do this at one point and pop their head up. And now what I'm going to have you do is you're going to push your elbows into the table and you're going to lift your head straight up. Just like that. Good. A little more for me. Good. And then lift the hands up and just hold here. Okay. So what you guys will notice in this position is her spine is nice and long, right? There's no clenching or crunching in here. She's tucking her chin, so she's strengthening those deep neck flexors. She's spreading her shoulder blades apart, so she's activating the rhomboids and the lower traps. And you'll see we're even getting a little shake here. So this might look like a simple position, but when done right, it's actually very difficult. So I'm going to have you come down again, Annie. And then come back up. Spread those shoulder blades out. Good. Tuck the chin. Good. I'm just giving her like a little pull this way because, again, we want to decompress the spine. We're trying to get everything set in the opposite of what would be considered kind of a poor posture, poor position on the computer there. Okay? And then from here, Annie, what I'm going to have you do is just slowly turn your head to the right without jutting your chin. Good. Turn to the left. Go ahead and maintain this position here of the spine. Good. So what you'll see here is we're trying to keep this nice position of the thoracic spine, and we're having her move her neck, strengthening those muscles around the neck and those postural muscles. Good. 2 more. Keep that shoulder up. Good. 1 more. Nice. And rest. Good. So the final variation we'll do of this exercise, I'm going to have Annie scoot down just a little bit. So now her arms are going to be a little more extended, so it's going to be a little more challenging. I'm going to have you, again, push through your elbows and drive your spine up off the table. Nice and tall. Good. Head's nice and long. Tuck the chin for me. Good. So she's nice and extended here. This is a really, really great position for the shoulders. Not a position that people get into often. A lot of times where everything's pulling and rowing and squeezing, but sometimes you just want to kind of lengthen everything, right? And you want to get strong from this lengthened position. So you can see her shoulder blades are glued to the rib cage here. They're nice and spread apart. We have nice even activation of all these muscles, so she's not clenching through the upper traps. She's using her rhomboids, her lower traps, her middle traps. And now what I'm going to have you do, Annie, is you're going to just pick this arm up and reach forward. Right? Good. Bring your palm up. So now she's really working this left side of the shoulder, right? So if you're someone with shoulder pain, neck pain, headaches, this is a great exercise. Come back, Annie. And then with the left arm, she's going to reach forward. Good. Utilizing all the strength of that right shoulder blade to hold her steady. Come on back. Perfect. The final piece of this exercise that we're going to use, go ahead and lift up a little higher, Annie. You doing okay? Mm-hmm. Is the abdominal breathing part, right? So if any of you guys have seen babies, they have kind of that baby belly, right? And that's because they're using their diaphragm really well to breathe. So the other thing that I'm going to have her do is I'm going to have her breathe into my hands here as she holds this position. So go ahead and push out into my hands. Good. So you can see that my hands are moving a little bit, right, as she's breathing. Good. Breathe in again. Breathe out. So the beauty of being able to work abdominal breathing is that it's going to take all the tension out of these muscles. A lot of times, as we get stressed out, we'll we'll breathe in through our neck and through our chest, and we'll create all this tension through the ribs. So we want to bring that breath down low so that all of this can be nice and relaxed. So not only are we strengthening the postural muscles, but we're also turning off all those superficial muscles that are creating that neck pain. Good. Give me one more breath here. Exhale and rest. Good. All right, guys, so that's a typical exercise, a very basic DNS position that we'll use after we do our soft tissue work and our adjusting. Again, just so that we can kind of change the mechanics of how she breathes and her posture to make sure that she's not only feeling better after the appointment, but for weeks and months afterwards. Thanks, guys.